And we're back. And we're moving into the second conversation for today. We're joined by representatives of the Ministry of Health to talk about World Tuberculosis Day. We have Dr. Keisha Westby-Leonardo, who's the National TB Coordinator, and we have Kevin Mendez, who is the TB and HIV Adherence Counselor at the TB Chest Clinic. Good morning and welcome.
Good morning. Thank you.
So,
World Tuberculosis Day. Why are we still talking about tuberculosis? That was the first thing that came to my mind, because you know there are certain things which have been faced, just like tetanus, and there are other things. Why is tuberculosis still a major conversation? And of course, I'm hoping you give us a little definition of what it is for those of us who don't know exactly what it is.
Well, first of all, tuberculosis is a disease that's caused by a bacteria called Mycobacterium tuberculosis. It is an infectious disease, and I guess that is one of the reasons why it's something that has not been eradicated. Globally, we still have many persons still being infected with the TB bacteria. It mostly affects the lungs, but it can affect other areas of or other organs of the body as well, and primarily causes a prolonged cough, fever, weight loss, and night sweats. Those are the main symptoms that a person with tuberculosis would have or would present.
and the first question,
Yeah, but can I add to?
Yeah.
Sure. World Tuberculosis Day is observed because it's still the biggest infectious killer that causes a lot of deaths worldwide, and it's not really, we don't hear much people talking about it. A lot of people think it has been eradicated, but it hasn't. But it's still present, and not much funding is going towards investing in tuberculosis. So, for instance, if you think about the theme of this year, which says it's time, it means it's time for us to scale up our interventions to address tuberculosis. So that's why it's still commemorated every year on World March 24th.
And still a priority for the Ministry of Health. You guys run what is called the Chest Clinic in Belize City, which shows that there is a specific need for a space for people who have tuberculosis or think they have tuberculosis. So tell us what our numbers are and how we compare to other countries.
Okay. Well, for Belize, for 2018, we had a total of 99 cases of tuberculosis. That's new and relapse cases of tuberculosis. But generally, we have between 100 to 140 cases per year. That's our average. And so for us, the problem is not, or has not exceeded what is expected by the World Health Organization for Belize particularly, but it is still a concern. We do have a small population, and it is something that we need to try to control and to contain, and that's why we continue to educate the public. We continue to try to bring public awareness to this condition, preventative methods, how it can be diagnosed and treated. So that we continue with our educational campaigns.
And how do we rank globally?
Globally, compared to other countries, it's not, we don't have a high burden per se. Mainly countries, for example, we have India, China, those countries do have a very high burden of TB compared to Belize. Even within Central America and the Caribbean, Belize is still, more or less in the middle. We have other countries with higher burden as well.
How is it contracted, and how do you avoid contracting?
Okay.
So it's mainly a respiratory infection, so it's readily available in the air.
That's not good news.
No.
So like when I cough incessantly,
If you have
contagious.
If you have active tuberculosis. And it's important to mention active tuberculosis because how the infection works is that it's two phases of the infection. So let's say when I was younger, I was taking care of somebody who I thought just had a cough, but in reality had active tuberculosis. So by being in contact with this person, I could have inhaled the bacteria, and the bacteria stays in my system, but because my immune system is strong, the bacteria is suppressed. So in that phase, I'm considered to have latent tuberculosis. But once, let's
wicked
say,
disease, man.
yeah, but once, let's say, I get my immune system compromised, let's say HIV or diabetes or any other disease, cancer, then the bacteria activates, and then you start presenting with symptoms, which Dr. Westby already mentioned, which the most common one would be the cough. So the cough needs to be present for this bacteria to be transmitted.
Yeah. So basically, it comes out of you and into someone else.
Yes. Yes.
Because we don't cover.
It is airborne.
Through saliva.
So whenever a person
Not through saliva, through the air.
So whenever a person coughs, sneezes, they release droplets with these bacteria, the TB bacteria, and so someone else has to inhale these to become infected by that.
Which is why congestion is one of your risk factors. So if you work in a very crowded space or
Crowded
in an
spaces
enclosed,
with poor ventilation, yes, that poses a risk factor for the transmission of TB.
So what can I do to protect myself?
Okay. Well, I'll let Kevin, as the adherence counselor, I know he's...
Kevin, answer Kevin. Go ahead.
So Marlene just mentioned, we do not have or practice proper coughing etiquette. So a lot of people, whenever they're coughing, they're going to go right away in their hand. I mean, you cannot transmit it through saliva, but just by, by doing this, you're already putting it onto the air. So just coughing or sneezing on your sleeve is a good practice. But let's talk about people that work in congested spaces or closed spaces. It's important to have proper ventilation. So we recommend people at least opening their businesses one time for the week to ensure that air comes in, so that the bacteria can get removed from the space. Because the bacteria can stay in an environment for up to 24 hours. Yeah. So it's important to address that. And then screening is also a big thing. We have been very active in screening for tuberculosis, especially for the latent phase, where people come to the chest clinic for a skin test. This skin test will diagnose if you have the bacteria in your system. But we have prophylaxis, which can be given to you to get rid of the bacteria before
if it's latent.
If it's latent, before it develops into active TB disease.
Yes. Yeah. And you also treat active TB.
And we also treat active TB.
But here's the thing about this disease. It's a long treatment.
It is. Yeah. The treatment for active TB usually lasts for about 6 months. Yeah. So it is a long treatment, but and that is why one of the reasons why it's important, that when we work along with the patients who are suffering from TB, we have to be doing constant counseling. We have to be working with them for them to be able to, successfully complete their course of treatment.
So Kevin, you're an adherence counselor, and I've spoken to doctors who can't even get people to stick to a 3-day antibiotic regime because naturally we start to feel better and we stop.
Right.
So what do you do to get people to consistently adhere to their treatment regime for 6 months?
6 months.
And it's every day?
And it's every day. Yeah. And the interesting thing about tuberculosis treatment is that we have to see people taking the medication. So I just can't give you the medication and be like, here's your pills, I'll see you tomorrow.
You have to see them?
So it's called direct observed therapy, where I come to visit you at home, because that's one of the things that we do. We do home visits every day. So I come to your house and I bring you the medication. Of course, we follow up on how you've been feeling with the treatment, if there's any other concern that has been affecting your treatment. And then I have to see you at the same time take your pills. The thing with with long-term treatment is that there can be various issues that could be affecting you. Maybe side effects of the treatment, so we talk about those things. Maybe you have been facing stigma at home because you have tuberculosis. So we talk to the person to see how they have been addressing or coping with the stigma, but we also talk to the family to educate them about tuberculosis, how they can prevent them getting infected, but also how can they support the individual. Because as adherence counselors, we're doing our role in supporting the individual, but it's also important to incorporate the family or friends so that they can also support this individual. So it's a very big team approach that we do.
How do you minimize the spread of the disease? Because if it is, that's fairly contagious. Maybe if I am at work. I mean, Kevin's probably wondering if I have TB now because I've been coughing for a week. But how do you minimize the spread?
Again, as Kevin had mentioned before, there are certain things that we try to promote. No, covering your cough, that's vital. If someone has been diagnosed with TB, we also offer face masks to use during the initial period. Of course, if they're working, they usually get sick leave from work. Also, it's important also because, again, there's so much stigma associated to tuberculosis. It's also important to know that if someone is adhering to their medication as they should, usually after 2 weeks to 1 month, they're no longer infectious or they're no longer spreading, the bacteria.
Okay.
So that is important to bring forward as well.
And the cost of the medication and all this follow-up care?
Yeah, everything again is the Ministry of Health provides the medication, the care free of cost to the patients.
Wow.
So the ministry does absorb these costs.
Can it kill you?
If it goes untreated, yes, it can be deadly.
How many deaths have we had?
For 2018, we had about 16 deaths.
Wow. I'm concerned about the high-risk environments. Your prisons,
Yes.
I would assume maybe your hospitals, I would assume as well. I'm just thinking about
There are a lot of-
about concentration of people like call centers. We
Yeah.
have this AC environment, you're there for long hours, your body's drained out.
Yeah.
And we have a lot of poorly ventilated buildings too,
Yes.
because they're all enclosed.
And that is one of the reasons which we do try to do screening campaigns as well. Not only for gearing up to World TB Day, but generally year-round, we try to do a lot of screening campaigns. So we do screening in the health facilities for healthcare workers. We also do screening at the call centers, which, especially here in Belize City, I know that the workers from Just Clinic are doing screening in the call centers and in other business places as well. So that is something that we try to
And we
do.
go to prison
And at the
twice a
prison,
month.
yes,
Twice
as
a
well.
month. And what is the situation behind there? I had a experience once with an inmate who was diagnosed with HIV,
Okay.
and in fact, the facilities simply just put him on solitary confinement. What sort of procedure there is to deal with the prisons? What specifically is done at the prison?
Okay, so the Chest Clinic has a good relationship with the Medic Center at Colby Foundation. So like I said, we go twice a month there, we screen people. Whoever is diagnosed with latent tuberculosis or active TB, we provide the treatment for them. So treatment is available at Colby as well. When it comes to HIV infection, we also provide a treatment for them. My role as an adherence counselor is to go and visit the prisoners that are on treatment and see how they're feeling with their treatment, if they have any questions, and see what kind of follow-up we can have for them. But when it comes to confinement, I know some people that would be put there, but it's not because of the infection, but be because usually of some sort of behavior
Behavioral
that
issue.
is.
Let me ask a question, because when you start to say that there's a link between tuberculosis and HIV, I imagine, people with HIV in 2019 are still facing a lot of stigma. And so they're fearful, for getting tested, for getting on medication, for letting people know. So if I don't even have HIV and I get TB, I don't want people to know. They'll make other assumptions that I don't want to happen.
Yeah.
So how do you work with the stigma part of it, and how much does it affect the people getting treatment?
A big way how we address stigma is by doing sensitization of general audience, of families. But the big thing is also addressing stigma of the individual, because self-stigma is big too. So a lot of it has to go through counseling. Education is key. And addressing, what are people's fears when it comes to HIV and tuberculosis. Like you asked if it's deadly, tuberculosis can be deadly if not treated, but it's important to also highlight the good things that can happen in treatment and the new science that is coming when it comes to these medications and in treatment. So this kind of gives some people some kind of hope, that, hey, I have this infection, but I can get cured.
Exactly.
But also, we tend to link persons with HIV or tuberculosis to other persons that have the same condition so that they can associate themselves and be like, I am not the only one with this condition.
And that's where I wanted to go. What is the new technology? What is there to look forward to in terms of medication or technology in relation to tuberculosis?
So medication, I am not sure how long ago, but there was like, people used, it's 4 antibiotics a person has to take to get cured of tuberculosis.
Yeah.
So isoniazid, rifampicin, pyrazinamide, and ethambutol. So people used to take.
That's on what you just said.
Yeah. 4 antibiotics.
For
I'm good with that.
antibiotics. Yeah. So these antibiotics used to be given on single pills, and it's by weight. So at some point, people used to take about 15 pills every day. Science has changed that now, like these 4 antibiotics are in one pill. So it's a fixed dose combination where people can take up to 5. The most pills they would take would be 5, and it's based on their weight. So this has helped with the treatment outcome because people are now taking less pills. You know,
Which means less side effects.
Less side effects. But it's just the burden about you going and seeing this battle with all these pills that you have to take. You get discouraged. By now you're drinking less, it helps with the treatment outcome.
Yeah. But you did clearly say that people who don't have HIV get the disease.
TB as well. And so, yeah, as you mentioned rightly, there's a lot of stigma associated, and sometimes, you know, persons would think, oh, if you get TB, that means you have HIV, and that's not necessarily the case. We do have TB HIV co-infections within our TB cohort, but usually, like for example, for 2018, it was about 1/3. 1/3 of the total number of persons with TB, 1 out of 3, were also had HIV infection.
And so the other 2
so the other 2/3 are not HIV infected.
So it could be diabetes.
So it could be, there are other immune
clients
conditions, diabetics. We've had a number of diabetics as well getting ill with TB.
Aren't we vaccinated against tuberculosis?
Okay.
Yeah,
So
confusion.
one form of prevention, yes, is vaccination in children. However, the vaccination coverage is usually for about 7 to 10 years, and it's mostly to prevent the more severe forms of TB in children. So we are, you know, adults, we're still at risk of getting TB, and as I mentioned, the coverage usually lasts only about 7 to 10 years.
How far are we away from a cure? You know, like, I mean, even in terms of HIV, there's significant moves forward. Tuberculosis, somehow to me, in the back of my head, is like way back, like measles days kind of thing.
There is a measles outbreak.
It is a measles outbreak still, but I'm saying that science, you know, we just cured at least foot. You know, why are we just...
Well, TB does have a cure, but yeah, it is curable, and that's the message that we are trying to get out.
Excellent.
The treatment, however, as we mentioned before, is a bit lengthy. It lasts about 6 months, but it is curable, and we have had many patients who have been cured of TB.
Once you get it, can you get it again?
Yes, you can. Yeah. Once you're re-exposed to the bacteria, you can become reinfected.
How severe is it? I mean, what's the difference between tuberculosis and a bad cough?
Okay, well, it is, as I mentioned, if it goes without treatment, it can be very serious and it can be deadly. The person can die if it goes untreated. However, in the initial phase, I guess, you know, the cough would seem similar to the flu or a pneumonia. So it can, you know, the type of cough, it does progress. So initially, they might start off with an annoying cough that continues to get worse and worse. It produces phlegm, a lot of phlegm. And phlegm? So mucus, cold. Mucus or cold, yes. So they would have this chesty cough, and that continues to progress.
But also, like,
over time,
if it goes untreated, it can also affect other organs. So it's not just the lungs that can get affected by tuberculosis. You can have tuberculosis in the eye, in the mouth, in the skin, the kidneys.
Because the bacteria.
Because the bacteria would moves to other parts of the body as well.
So how do I now? I mean, really, people are it's flu season. I don't know if it is, but a lot of people have the flu. They have a cough. They haven't gotten rid of it. How do you know the difference between whether I'm just getting over a cold and flu or if I have TB?
they would have to get screened. And that is why we do encourage anyone who has a cough more than 2 weeks duration, they should be screened for tuberculosis.
Yeah.
They should go in and get checked
Yeah.
and be screened.
But there's also like the other symptoms that are associated. The
Of
fever,
course.
the
The weight
fatigue,
loss.
weight loss, loss of appetite, night
Night
sweats.
sweats.
So those are the other symptoms that we have to be looking out for.
Is there a profile risk group, like for example, like children between the ages of whatever and whatever, adults
Vulnerable
between, is
populations.
there a vulnerable population?
Okay, when it comes to vulnerable populations, we have children, the elderly, any person who has any type of immune suppression or is immunocompromised, whether it be because they're diabetic, living with HIV, due to cancer, or taking any type of immunosuppressive drugs, alcoholics and drug users, prisoners, and persons in confinement. Those are our main risk populations.
But there's
And the
also-
age?
And
You said children, but
Children and elderly.
Oh, children and elderly.
Again,
Yeah.
because of the children, because of the undeveloped immune system, and elderly because, again, the immune system is compromised as you get older.
yeah, but I've also noticed that we're having quite a number of cases in persons that have very poor socioeconomic conditions. So at some point we had a conversation about 2 days ago where people think tuberculosis is a third world disease because people are in houses that are very poor conditions, a lot of people living there, they don't have
And
adequate
overcrowded.
food,
Yeah.
so like these conditions also tend to increase the vulnerability of persons
Wow.
to contracting tuberculosis.
Where are we seeing the highest concentrations of tuberculosis cases?
Okay. The area with the highest burden is, Belize City, the Belize district. Also, I guess, followed by the Cayo and the Stan Creek districts. Those are the areas of highest concentration.
Okay, so I think everybody's kind of saying, wow, okay, we need to pay attention more to TB. And while you're saying 100 cases, I'm glad you brought up measles, because I think sometimes we think these things are simply gone and we don't talk about them as much.
Exactly.
And then somebody comes to remind us that it is still a problem.
Exactly.
So how are we commemorating World Tuberculosis Day?
Okay, we're commemorating World TB Day by carrying out a series of activities across the country. Yeah, so across the country we're holding health fairs. We've also been, throughout the month of March, we've been doing ongoing health education at schools, screening in healthcare facilities, in various workplaces and businesses. We've been carrying out screening as well.
Okay.
We are having, during this week and next week as well, we are carrying out health fairs in the various districts.
Okay.
So a number of facilities are hosting their health fairs tomorrow, Friday the 22nd of March. Here in Belize City,
It's
it
going to be
will,
at the Battlefield Park
Okay.
from 9 a.m. to 3 p.m.
And can you get that TB test there too?
You can get your latent TB screening there.
Okay.
But
How long does it take?
it's just important. The TB screening, less than 5 minutes. It's a
But the
small
results?
protein that gets under your skin. But it's important that everybody that comes to get screened for TB needs to come back within 72 hours for us to check the result. So you need to come presently, and the nurse will measure if there's an induration on the spot where they give you
Induration.
Yeah.
any reaction, swelling.
Reactions.
Yeah.
Swelling.
Well, trust me, if anybody sees something growing on that spot, they're going to come back to you.
Yeah.
So what you're saying is, if I find out that, as a child I was exposed to TB, I don't have any symptoms right now, I go do this test for free tomorrow, and I realize that something funny is happening to that spot you touched, I'm going to go back and you will treat me so that I don't get TB when
We do
I'm
have preventative
having a
treatment,
weaker
yes.
We can give you
Immunosuppressive.
prophylaxis.
Yes.
Yeah.
And how long does the preventative treatment last?
For 6 months.
6 months? So both the latent and the active are both 6 months?
Yeah,
Yes,
but the
it's-
difference is in the antibiotics that you're going to be taking.
Yeah.
So active is 4 antibiotics, the latent is 1.
Just one.
Yeah.
Okay. Understood.
Wow. Okay. And is that the only test you'll be able to get at the health fair?
So we're going to be doing glucose testing, blood pressure checkups, free HIV test as well. And the reason why we're doing all of this is because just having in mind that it's not only HIV but other diseases
Health
or conditions that can be related to tuberculosis. And at the ministry, have been working very hard on ensuring that people have access to comprehensive care and targeting men a lot to come and get screened. So by giving, this package, we hope that, people might be more receptive about coming.
My final question is, it's a healthcare problem in Belize. Belizeans just think, we always see healthcare as a third person perspective. I not catch that. That on me. How do we register a home that this is something that should be registered on my radar? This is something that I should go to this health fair and do, as opposed to passing the diabetes hut, to passing the HIV hut stall. Why is this particular disease something that I should pay attention to?
For instance, whenever we're talking to doing contact screening for tuberculosis, the big thing is a lot of people have goals, for instance. So it's like, let's talk about your goals and what do you want to do. And in order for you to get to those goals, like let's say your children graduate, for instance, you need to be healthy for you to be there. So we tend to target, those emotional sides of people for you to be able to be more health receptive. But again, health is priority for all the things that you want.
But people access the free testing at the health fairs?
Yes,
Yeah.
we do.
Yeah, we do have a good turnout. And we also have a good turnout at the clinic as well.
Okay.
So it's a good thing that we're here because a lot of people don't know the chest clinic exists.
So where is it, in Belize City?
Yes, we're based at Cleopatra White.
Okay.
So it's the second floor building at the back.
Okay, and in the rest of the districts?
Yeah, the public health nurses are the ones who oversee the TB management and care in the remainder of the district. So at all the public health hospitals, or at all the public hospitals and facilities, they can get screened and treated for tuberculosis.
Yeah.
Okay.
But also, let's say you have a relative at home that's unable to come to the health center. You can give us a call, and then as we can go to your house and check on the individual and screen them there. So there's also that availability.
So there's a lot of concentrated effort in this disease. Are we setting a goal that we want to, like polio, someday end the presence of it in this country?
Yes, in alignment with the strategic development goals, yes, the Ministry of Health is working towards ending TB.
Yeah.
That has been the slogan for various years, actually, putting an end to TB. Even now, where the team is, it's time, we look at, it's time to end TB. So yes, we do have goals that we are working towards in order to, bring an end to this epidemic.
All right, well, thank you for letting us know the work that you have been doing. And we wish you the best of luck, and we hope people take advantage of the health fair tomorrow in Belize City. It's at Battlefield Park in your own individual district. I guess check out Ministry of Health's Facebook page to get those details, and you can get the testing done for free. So don't miss the opportunity.
Right.
But once again, thank you and best of luck.
Thank you too.
We're going to go ahead and take a break. When we come back,
When we come back, we have the Smart Hurricanes.
it's basketball. It's his favorite topic.
It's trash talking. It's going to be straight trash talking. But the hype is going to be there because the game is coming up. So stay tuned. On the other side of the commercial.
Okay.